routine so we can get started. I think people will filter in as their evenings wrap up, and hopefully people can have a glass of wine or maybe you just, I'm really into these like CBD cocktails these days. So whatever you need to sort of wind down, we're grateful that you're spending your evening with us.
Just throw them in, yeah.
Yeah, whatever you need in the background, you're muted. So do whatever you like. But we're so excited for you to join us. I'm Allison from Origin, and we have Emily from OhNut and Morgan also from Origin here for an event on sex after pregnancy, and more importantly, getting back to pleasurable sex. I know this is something that so many of our patients struggle with, and having sex for that first time, or sometimes even that 10th time postpartum, can just be really emotionally fraught and unfortunately super scary. And I've had so many friends recently who've been new moms who are like, that's their number one thing that they want to talk about and are just kind of have the most sort of uncertainty around. And so we're here to hopefully take some of that uncertainty out of the process and really give you the tools and resources to make sure that you're both physically and emotionally prepared. And hopefully also will provide some resources that just make sex more pleasurable from a broad perspective, whether you're postpartum, pregnant, or really anywhere in, even if none of those above apply to you. So as a quick reminder, we are recording this session and we will share it out with anyone who registered afterwards. So if you have to hop off or something comes up, just feel free to, to hop off. You'll still get access to all of this content. And just a reminder that this is not medical advice. So we always recommend, if you have questions after this, to speak with a provider, or you can book an appointment with one of our PTs as well, if it's a PT related question. We got a couple of questions from people who registered in advance, so I'll work some of those into the discussion. But if you have anything that comes up as we're chatting, feel free to pop it into the chat or into the Q&A, and I'll make sure that we cover those during the discussion. But with that, I will get us started. So I'm Allison. Like I said, I lead the marketing team here at Origin. And just to share a bit about us, we are a women's health company really focused on pelvic floor and whole body physical therapy. So how can we make women feel good at every stage of life, whether that be sexual health, pregnancy, postpartum, or into menopause? All kinds of things happen to your pelvic floor and really your whole body during those times. And we are here to provide the support for women around those pain points or issues. And one of our biggest beliefs is really around accessibility with these types of issues. And so we are an in-network pelvic floor physical therapist, work with most major commercial insurers. Yeah, it's a pretty big deal and something that we're really proud and excited about. And we'll be talking a lot more about your pelvic floor. So you'll learn a lot of that from Morgan. And I'll let Emily give a little bit of a brief overview about OhNut and sort of what they do too, just to get us started.
Yeah. So OhNut, I'm the CEO and inventor by necessity of OhNut. To be totally honest, after looking for help unsuccessfully for over 10 years in my experience of painful sex, I felt completely powerless in a body that I didn't understand. Meanwhile, 75% of women and people with vaginas will have painful sex in their lifetime. And that 75% is only people who have reported it. That number is likely significantly much higher, specifically postpartum as well. So at OhNut, we have created this lovely wearable. It's really amazing. It allows you to customize penetration depth. So real quick, the way that it works is it's worn at the base of a penetrating partner. And during sex, it compresses down like a bumper. So you can control how much goes in. Rings don't go inside the body, and they can be added or removed at any time during any position, which is great for both partners. I did that fast. We can feel free to ask questions about that later. But yeah, I mean, again, our goal has been education, communication, and affirmation. So a lot of people don't really understand what's going on in their body, and they don't necessarily know what to do about it either. And what happens over time is that it gets internalized. So our approach is kind of offering the tools to address that, and then also the whole human as well.
Totally. I love that philosophy, and I can't wait to get into this content. And our other speaker, Emily, just did a great job of introducing herself, so I won't even bother because she has an incredible story, but is Dr. Morgan Connor, who is a physical therapist with Origin, actually, in our San Francisco location. So with that, though, I will turn it over to Morgan and Emily to get us started.
All right. I'm Morgan. I'm a physical therapist here. I have a specific interest in pain with sex and just sexual health in general. And I've actually been a huge fan of the OhNut since I started in pelvic floor PT. So it's really exciting for me to be talking with Emily today. Can you all hear me? I just had something talk to me weirdly. Okay. All right.
You're good.
All right. So we're going to be talking today about a couple different things. We're going to start with, sex should never be painful. I'm going to add a little asterisk on that, which is unless you want it to be, but that's a different discussion for a different day. So just want to make sure that we are inclusive with that. So let's talk about the pelvic floor. Pelvic floor is kind of like a hammock at the bottom of your pelvis. It is incorporating a couple different muscle groups, some connective tissue. It really is a support system for all of your pelvic organs and really for the bottom of your trunk. So it has a couple different outlets for if you have a vagina, a rectum, and a urethra. In terms of where it comes in for painful sex or sex in general, the pelvic floor does go into this controlled spasm during orgasm. So that is kind of normal function. It needs to relax to allow for penetration. If it doesn't relax, that could be cause for pain, among other things. So we'll get into those a little later. All right, so other things, other reasons for pain: infections. We could have a yeast infection, a bacterial infection, some sort of STI, STD. So there could be various symptoms of that. This is not something that we're going to be treating in pelvic floor PT. So this is why it's important to go to your doctor first, to a gynecologist, to your primary care, and make sure that we're ruling out these, because really, if you come into PT with this, we're going to send you right back there anyway, because this is outside of our realm. But that's not to say that these can't eventually lead to pelvic floor dysfunction and could end up with you having to have PT anyway. But we do want to make sure that you're taking care of that immediate infection.
How does that lead to pelvic floor dysfunction?
Oh, how does that lead to pelvic floor dysfunction? So if you have pain when you are having an infection, you're probably going to tighten your pelvic floor up. Kind of this whole guarding cycle of pain. If you're tightening a muscle and then say you are having penetration and you are rubbing against a tight muscle, probably not going to be comfortable. You're probably going to keep guarding. And then that cycle just keeps continuing. You're going to guard, there's pain, you're going to guard some more, there's more pain. And so, yeah, fun times.
Sorry.
So kind of the next step of why there might be pain is really at the skin or the tissue level. So specifically in a postpartum situation, there could be perineal or vulvar or labial tearing, and that could be something that's either not healing or it's healed and it's sensitized. So you just had a cut in your skin, it was stitched up, it was really sensitive, it could still be sensitive. So if that is the case, even just rubbing or touching that skin, getting it used to having something touching it, could help to start decrease that sensitivity, decrease that pain. So, using a little lubricant or some coconut oil or something that you feel comfortable touching your vulva with can be a good way of decreasing that sensitization. There could also be hormonal issues. Again, this could be something that is specifically postpartum. If you are lactating, that estrogen is usually going to be a little lower. Those tissues are used to getting estrogen. They could be a little more fragile, a little bit more sensitive. That decrease in estrogen could also lead to some vulvar dryness, difficulty self-lubricating. So you could use a topical estrogen. Again, that would be something prescribed by an OB, or even a vaginal or vulvar moisturizer can help just get that skin a little bit more lubricated and start to make a little bit more, what am I thinking? Like it's moisturizer anywhere else in the body. You're getting that skin more robust, able to tolerate a little more touch. Or you could just wait till you stop lactating, which is not the best answer, but usually it does go away as that estrogen level normalizes. And then the last thing is just little cuts and tears. If that muscle is really tight and that skin is getting really tight, and then you stick something inside of it, it might tear and it might rip, and that's not fun either, but that could be a reason for pain. So trying to, again, that topical estrogen might be there, a barrier cream like Aquaphor or Vaseline can help that skin to heal again. And with all of these, again, these are more medical level reasons that we could see in PT, but if you really think something like this is going on, especially those hormonal issues, get your doctor on board and let's get them starting involved in the process. And Emily, anything to add with that?
No, I'm excited. I added the deep dyspareunia at the bottom. So that's where I'm amped to dive in.
All right.
Going, and then I'll
You like to go deep, Emily.
Yeah, that's my jam.
Awesome. I love it.
Thank
All
you,
right.
Brad.
So kind of getting to the last place, which is where PT and the OhNut, I think, are really the shining stars here, which is the pelvic floor muscle tightness. Again, it can feel like dull, achy pain. It might even feel like a UTI or a yeast infection, because it might have started there, but you might go and have it checked out at a doctor and then there's negative. Everything is negative, and it's just that pelvic floor mimicking those symptoms. What we can do in PT to treat that is really teaching you how to relax your pelvic floor. So how to get that pelvic floor out of its tight and guarded state and into that relaxation. If that is really not working, then we can go towards more of a medical management strategy. Again, not PT, this would be a doctor. But really what we're doing in PT, we're looking at dilators, we're looking at wands, we're looking at fingers to use to help get your pelvic floor relaxed, and then a lot of education. So teaching you how to relax your pelvic floor. And then Emily,
add that real quick. I think it's super important to understand prenatally the state of the pelvic floor and postnatally, so that when you understand the root causes, you can differentiate between what's new postnatal versus prenatal. And again, having that awareness prenatally can allow you to address some of the symptoms early.
Yeah, 100%. Yeah.
Back to you, Morgan.
I think I was actually going to say, do you want to take over on deep dyspareunia there?
Well, yeah. Well, and then I guess even before that too, I think kind of like getting into pelvic floor function, like the importance of that relaxation also around the rectum as well, because with the relaxation of the rectum, then the vaginal canal but then the uterus has the ability to extend and go back. And one of the causes of deep pain during sex, if there's like restrictions within the pelvic floor. So if there are, pelvic adhesions, scar tissue, anything that's inhibiting mobility, because basically when something enters the body, everything should kind of be free floating. So if anything is prohibiting that from happening, then there will be pain. Also, lack of arousal can prevent the vagina from expanding. So that's like a pretty fundamental concept as well. And then just getting.
Can I piggyback quickly on your comment around the rectum? And I think thinking about just getting into, anatomy nerd land, the anal sphincters are part of the superficial pelvic floor. So even tightness around the anal sphincters can lead to tightness around the more superficial pelvic floor muscles and the muscles around the opening to the vagina. So making sure that both those muscles are relaxed, and then also anal sphincters. I feel like a lot of times that missing piece for folks is figuring out how to also relax around the anus so that there is that free flowing movement like you were talking about. And that,
it's interesting also, like constipation is a cause of pain during sex. And that's super common throughout the pregnancy journey. So it's interesting. It's not always having to do with the vagina or, like specifically. And then I think another really important thing to add here. So we kind of talked about the physiological causes of pain during sex, but, I think trauma is something that it really could not be stressed enough. As one of and we'll get into it on the next slide, but as one of the causes of pain during sex and you were kind of talking about that fear response cycle earlier, with how infections can potentially cause pelvic floor dysfunction. Similarly, like any kind of psychologic impetus, could again spark that avoidant fear response cycle that perpetuates the physical.
Yeah, absolutely. I think any spark that gets you into that guarding cycle can, be an entrance, and then you can start spiraling within it.
Yeah. Hey, let's go to the next one. I'm pretty amped. This is like how we live in OhNut land in the biopsychosocial model, because female arousal is not just, again, it's not just about the body. But really it is. So you're breaking it down to here.
You'll die on that mountain.
Yeah. The biology, your genetics, physiology, your body integrity, what's happening physiologically to your body, psychologically. It's like, how do you feel about your body? What are your motivations for having sex? What are you looking for? And then social, this is a big one. What are our cultural values? What is media imposing on our view on what sex means, or what our body's supposed to be doing, or how we're supposed to be functioning as a partner? And that, religious beliefs obviously inform that as well, and relationships. So it's really important during the process of talking about pain during sex and even pleasure during sex, not just to focus on, the vibrator that's being used, or even just the stretch that the body should do. It's really asking us why we're having sex to begin with. How do we want to feel about ourselves when we have sex? What does intimacy even mean? And then when we actually get to those root answers, then we're not beholden to this blanket concept that I want my sex life back and my body is different now and I want it to be the way that it was. Because that can cause not just pain during sex, but relationship stuff. There's a lot of catalysts that come out of, oh God, I feel like I jumped the gun on that.
Sorry, that's my bad. Hold on,
No, you're good. You're good. I think actually we can keep going.
No, but I mean, it's so important. And I hear this all the time. Like I said, I have so many friends who are like, my vagina doesn't look the same. And that, especially postpartum, and like the concerns that play into that, on your own level. And then as you have all these fears around your partner, and it all contributes to, sort of your libido and arousal and like your own body confidence, and all that impacts that postpartum time.
Yeah, for sure. We can keep going if you want.
All right. So love this survey that we brought up here. I think that in terms of inclusiveness, also the survey did ask people who identified as mothers and moms. I think it's good to acknowledge that not all birthing parents identify as mothers and identify as moms or identify as women. So that being said, I talk with a lot of people who tell this to me, and sometimes it's just a matter of kind of talking through it. And sometimes it's a practice period. I do a lot of practice with people in terms of just like, let's try and use a dilator in the clinic right now in a safe space and see if that feels comfortable. And sometimes it's fine. And sometimes there's not an issue. And it's just a matter of, being afraid to try something new after having this huge event happening. So, yeah. But I think this is great. Yeah.
It is great. I did look up the study and I want to add to this. Mm-hmm. That's okay. So the result says 73.9% of women said the quality of their postpartum sex is the same or better than postpartum. So I just want to recognize that this stat represents the same or better, not just better. And it's really important. I did, because it's setting unrealistic expectations. I just, again, like managing expectations around what sex looks like after postpartum. I mean, honestly, like if we were to look, it's almost like considering sex or the changes in our sex life as stages, prenatally, like before any of the body changes started happening. If you were to rewind back 10 years in time, your sex life looked very different I'm just going to say numbers right now, regardless of when you got pregnant, but it looked very different in your 20s than it did in your 30s. And yet we don't really reflect on that time with a sense of mourning, because that change was gradual. But if we fast forward 10 years, and just know that the changes to our sex life are going to happen, but that doesn't mean it's going to get worse. If we actually, again, tune into this idea about what it is about sex that's important to us, and then take the steps to make sure that at the time that we do want to have sex postpartum, you actually want to have sex with the person that you're with. Because that could be a big piece of the puzzle talk about pain during sex. If you don't like your partner, it's not going to feel good.
Yeah.
So really ensuring that, we take care of our bodies and our relationships while tuning into our own goals throughout that process.
Yeah. 100%. I completely agree. Oh my God, it moves. I didn't see that.
So excited. I think the first one I actually love. Wait, go back. Where are you going? Okay. So this one I added. So it's interesting, and I would love to kind of talk about this for a minute. And Morgan, I'm curious to hear your thoughts. Yeah. People constantly tell us that the 6-week appointment is absolute garbage. And I wanted to, kind of get into what is the actual green light to have sex again? What are doctors looking for? And then how people can set realistic expectations. Mm-hmm. And I'm so based on my understanding, that 6-week appointment happens so that a provider can make sure that like lacerations are healed for the most part, and that there is no sign of infection. So 6 weeks basically guarantees that infection is off the agenda. Yeah. That's where they're basing that decision.
Yeah. Usually my understanding too, and again, not being an OB, I'm maybe not the best person to be answering that question specifically, because usually I have referred people back, but also looking for, again, has vaginal bleeding stopped and has the chance for a retained placenta kind of gone down there, which usually, and PT, when people are still bleeding kind of, 6-8 weeks later, that's when we're starting to be more concerned about that as an issue. But I think, you're right on it, checking to make sure any lacerations, any cuts are completely healed, and checking for infections.
Cool. And generally, like them giving you the physical green light doesn't mean that you're physically ready or mentally ready.
Yeah.
Just know that that's totally okay. Some people just push out. I don't know if there's like a PT recommended time, but is some folks say just like make it 12 weeks, just give yourself that space so that nobody feels that pressure.
I think it's so variable. I've had people who are at 6 weeks and are totally ready. And then I've had people who are at 6 weeks who, feel physically ready, but not emotionally or mentally ready. And then, it's kind of all over the board. I think, from the medical perspective, I think 6 weeks is an okay time to start to consider whether it's safe or not. But I think it really should be more, okay, if you want to have sex, you're cleared medically. I think that would be a little bit more comfortable. I frequently tell people, well, it seems to me like you're probably going to be okay, or you're probably not going to have pain, or sometimes they'll be like, yeah, you might have pain. And then it's quickly followed up. You can try, but it's only if you want to. You can go back, but only if you feel ready and you want to. So I think having that kind of second part of if you're ready and if you want to is really important.
Yeah, agree.
I think we kind of covered this-ish in the last slide. I think a lot of times when people think about pelvic floor, the first thing they think about is a Kegel or a pelvic floor contraction, which irks me to no end.
I'm so glad you just said that. I have such a problem with these. Oh, do you know that Kegels were invented at like the same time as the atomic bomb and Mr. Potato Head?
Oh my gosh.
Like it's unfortunate that it took that long for the pelvic floor to really get the attention that it deserved, but it just goes to show like our understanding of the pelvic floor is so limited by Kegels.
It's so limited. One of the things I tell people a lot is, okay, you've probably heard about Kegels and the pelvic floor. The pelvic floor is the only muscle in the body that the only way we talk about it as a great society is how to tighten it and how to contract it. All other muscles, we talk about strengthening, we talk about contracting, and we talk about stretching. This is the only one where we don't as a society have this greater conversation around both sides, that muscles need to relax and lengthen, and they need to tighten and contract, and you need control of that range.
How did we get there culturally? Because the idea of how to have a healthy pelvic floor is reduced to how to have a sexually appealing vagina. And most people assume that Kegels make your vagina tighter. And that is false.
Yeah.
And if you want to talk, I would love for you to talk about that.
Yeah, I have told people at times to stop doing Kegels because it's not what they need. That being said, you do need to be able to contract the pelvic floor. If you can't, you need a pelvic floor that you can contract, that you can lengthen, and that you can contract and lengthen when you want it to contract and lengthen. So, that if it's tight and you're doing more Kegels, you're just going to get even more tight. And that can feed in again to that cycle of pain, that cycle of guarding that we talked about before. Yeah, go ahead.
No. I'm sorry. I'm like interrupting Cow. It's okay.
No, please. I think you were going to probably say something that I would agree with.
Well, I also this idea that it's making the vagina tighter. The vaginal canal is a canal that does not actually get tighter. Yeah. It is the surrounding muscles that where you're increasing function, and kind of what you were saying, you increase the ability just to contract and relax.
Yeah.
So, which also encourages blood flow to the area as well, which is also necessary for sexual function.
Yeah. Well, and I think too, separating out between the vaginal canal and the intrinsic muscles of the vaginal canal and the pelvic floor muscles, which are actually two different things. The pelvic floor is it's a gateway into the vagina, and then the vaginal canal has its own smooth muscles. Doing your Kegels or doing your pelvic floor contractions are only going to tighten that entrance.
So the first 3 inches, would you say?
It's less than that. It's it's paper thin. It's not even the first 3 inches. I think it's like a half an inch or less. The pelvic floor muscles are fairly thin. I need to go back to my research to look at that, but my understanding of the pelvic floor is it's fairly thin, and then the vaginal canal comes through.
It's amazing how the Kegels have just the tight vagina thing is really unfortunate. And even Cardi B, the WAP song, it's like, I do a Kegel while you're inside. It's like, you don't need to do that. That's not helping anything.
No, it's not, especially if you're having pain.
Yes, exactly. But it just perpetuates this idea about Kegels for tight vaginas, and then that's sexually appealing. It's not helpful, and there's so much more you can do with pelvic physical therapy and just
so I guess how do you, I think that's for all the women, I was always taught also this whole misnomer around Kegels. So as you're thinking about re-strengthening your pelvic floor in that postpartum period, if you are hoping to get back to sex, what are, I guess, the most important exercises or things to work on?
I think, if a Kegel is important if you can't contract the pelvic floor, if you don't have that strength. Again, we talk about that contraction that happens during an orgasm. So you do need a contraction in terms of where the pelvic floor is during sex. But I think, I may have lost my train of thought. Having that Kegel is important, but you have to have the relaxation afterwards. So if you're not able to also relax your pelvic floor after you squeeze it, Kegels are not appropriate at that time. So work on that relaxation, work on maybe even just contracting and relaxing. So getting that movement through the pelvic floor, and then work on more of that tightening and contracting to find that strength. But I'm
diaphragmatic breathing kind of stuff.
Yeah. So I don't know if we have this somewhere else, but that the natural flow of the pelvic floor is to relax as you're breathing in, and then to contract as you're breathing out. When you look at more globally throughout the whole trunk, your diaphragm contracts during an inhale to make room for breath in your lungs. All your pelvic organs slide down right into the pelvic floor.
Here, tell me what to do. I'll do it.
All right. So as you breathe in, your belly is going to expand. So that's that diaphragm pushing down to make room for your lungs. And then all the organs and a baby inside there are going to drop down towards your pelvic floor. Your pelvic floor is going to need to relax. It should feel like it's opening, softening, relaxing. And then as you exhale, everything is going to kind of squeeze and lift and come back up and in. So there's this whole kind of up and down float as you breathe in and out. So that is where I start so many of my patients. Homework on day one is, okay, I want you to breathe in and relax your pelvic floor, and I want you to exhale and contract.
It's actually relatively difficult to coordinate in the beginning, because I think when you inhale, your chest lifts, but actually when you inhale, your belly
should be lifting. Yeah, you're blowing up a big balloon in your lower trunk. And then on your exhale, everything is pulling in the stomach, comes back in, the pelvic floor contracts, and you can exhale and the air comes back out your mouth. So I think, does that answer your question, Allison? I think I got a little sidetracked there.
Yeah, no, I just think, like for people who are thinking about like, wanting to heal in that postpartum period, and just really making sure that they're one, not overdoing it. Cause I know we talk about that a lot, like don't push yourself, but just, if Kegels aren't the best way to get your body feeling like, how you want it to feel, or in control, or, continent, or things like that, sort of what are the best ways to make sure that your muscles are strengthening appropriately.
Yeah. I think, finding that full range. And again, not to say that pelvic floor contractions are bad. They are just not for everyone at all times. I think. All right. So in terms of returning to sex after baby, I think we talked about some of these in terms of why it can be uncomfortable. So that decrease in lubrication, again, coming from that breastfeeding, that low estrogen, and then that scar tissue, kind of overactive muscles, birth trauma, post-traumatic anxiety. I think we've covered all of these in other slides, but it's also nice to have them all here together in terms of postpartum discomfort. Yeah. So in terms of how to get back to pain-free, go ahead.
We'll go to the next slide.
Yeah.
Woo.
Yeah. I think one last thing that kind of goes with that last slide that I talk about, no, it's fine. In terms of sex, unlike a lot of other things in PT, at least that I deal with, we're not getting you just out of pain to kind of neutral to where you don't have pain anymore. It's not just the absence of pain. Sex is something where we need to A, get you out of pain, and B, get you into pleasure. So it's not only taking out a negative, we need to get into a positive as well. So I think that is something that's really important to remember, especially for us in PT in this area. Anyway, that's it.
Like, how in the world, I mean, I don't know how dexterous, that's not the word. I'm like, I'm pregnant right now, and a lot of these are off the table. I'm like, that one on the bottom left is like never worked for me. I don't know. I've tried it. It's not for lack of trying. It's just like not.
I mean, the bottom left is also doesn't seem like it's when I'm looking over at the list here in terms of standing bent over slightly. That's definitely not bent over slightly.
we need to make our own better illustrations for these. This is as good as the internet can give us.
Okay.
Well, I guess, go.
I think, one of the things that I tell people in terms of position is, someplace where you can relax. So, pillows are your friend for sure. Prop yourself up. And then if you are someone who's worried about depth of penetration, being on top and being in control of where the movement is going to give you more control. However, being the more active partner, being someone on top, is going to make your pelvic floor work a little harder because you're having to hold yourself. I haven't forgotten about the OhNut. I was going to put there, but we're talking about positions. But I think with any of these, if you're worried about depth of penetration, if you're worried about pain, even if depth of penetration is not an issue, that I think that OhNut, having tried it out recently, I'm like, if I'm going to talk about this, I want to be able to talk about it from a point of experience. And even just having that bumper to, in terms of postpartum, when we talk about the skin being irritated, having something softer, having something that's going to cushion that impact on the external tissues, I think is something that's super helpful. And, keeping depth shorter is going to help with pain because you're not getting as much friction along those tissues at the pelvic floor. I know we're in the position slide, but I just can't sing your praises enough. It's a product I've loved since I've heard about it. So yeah.
Well, I mean, there, because also just in general, PT can address so many of the issues, but it's that last like 10% deep, like that deepest 10% that's hard to address. I mean, especially postnatally as well, with the sensitivity deeper, the potential prolapse. Yeah, I know we said it a million times, but a big part of sex feeling good and in whatever position you're in is being able to mentally relax. And when you're constantly worried about something going too deep, then all of a sudden the whole body shuts down and there's like the mouth closes, like we stop talking about it. The partner's concerned that they're gonna, like, they don't want to hurt you. You don't want to be in pain, but nobody's saying anything. And like, I know we're on the position slide, but like having something in the bedroom that's easy to talk about really gives you the freedom of doing different positions, to be honest. So when you're just like, hey, let's try this position with 3 rings, like let's try that position with 2, like let's add one, let's take one away. How does this feel? Like basic questions that this allows you to say, like, how does this feel? And then you say like, it feels great. And then the other person's like, oh, thank God. And then you can actually enjoy your body.
Yeah.
The whole point.
And one question we had too, which I think is like an interesting, would love to hear your take on this, Morgan, is just as it varies, if you delivered via cesarean birth or delivery, like how does that change that equation? Obviously, I know your pelvic floor is still impacted from carrying a baby for 9 months, but are there other things to think about either in terms of positions or just in terms of kind of that return to sex moment?
Yeah, and I think making sure that your abdomen and the area around the scar isn't super sensitive. So desensitization practices around that, starting with just touching your scar, rubbing the scar, rubbing that area, getting that area used to contact. Intercourse and sex is a full body sport. So being able to tolerate contact there is super important. I think, being able to tolerate contact on the more external genitalia. So not just penetration, if touch on the vulva is uncomfortable, penetration is going to be uncomfortable as well, because it's really hard to separate those two. I found a lot of times, not even a lot of times, but sometimes more often with cesarean births versus vaginal births, is that tightness in the pelvic floor can be more common because the pelvic floor didn't just get stretched out to a million times its length to have a human exit your body. Not that means that you're not going to have a tight pelvic floor or have pain with sex, but I think that it is a little bit more common in terms of what I've seen anecdotally to have more difficulty with relaxation and more tightness in the pelvic floor after a cesarean birth. So
I have a question also. 2 questions. Do you pronounce it diastasis or diastasis?
I say diastasis.
Diastasis. Okay, great.
But they're both right. I'll know what you're talking about.
So there's a lot of commentary around not maintaining an arched position and also not sitting up from the supine position. How would you put that in the context of like missionary during sex?
Are you talking about during pregnancy or when you have a diastasis?
Both.
Both. I think, when you have a diastasis or even during pregnancy, still engaging your abdominals to keep that muscle tension and those muscles active can help to decrease the extent to which a diastasis A forms or B becomes problematic in terms of trunk support. So to be honest, I haven't thought a lot about that in terms of positioning with sex with penetrative sex in terms of a diastasis during pregnancy. But I think, my go-to is, listen to your body. If it doesn't feel good, don't do it. And experimenting with various positions that do feel good with that. So I'm sorry I don't have a better question, but I'm going to be thinking about that for the rest of the evening.
Okay. It's fun. I mean, positioning that kind of gets like left off the radar a lot of times. It's like, just try pillows and just use lube. And you're like, that's more specifics, please.
Yeah. I mean, sometimes, if you have some sort of dilating or penetrative thing, testing around on your own when you're not necessarily with a partner, or when you don't have someone else's arousal in the whole situation, and where you're trying to have some intimacy and practicing figuring out different things on your own can be super helpful, I think, as well.
Yeah. Awesome.
I
kind of threw these in here.
Yeah,
I mean, this is kind of getting back into like biopsychosocial. So this is the psycho part of it and the social part of it. And again, making sure that at the time that your body is ready to have sex and you want to have sex, that you want to have sex with the partner you're with. So first identifying what your needs are. I mean, I guess like full disclosure, I mean, so I'm 5 months pregnant, my body is changing, and sometimes I feel really bummed about it. And my partner and I were intimate recently, and we like pulled out all the vibrators and we put music on, and it wasn't the right music and the mood wasn't right. And I was like really sad. It was like kind of a whole unfortunate situation. And like when we were just like laying there afterwards, I said to him, I just don't feel sexy. And he like very wonderfully said to me, just because something has changed doesn't mean it's lost. And it really means a lot to me. And I was just like, and then it got me thinking, well, like what has changed? And if it's not lost, then what is it? And, again, kind of asking those questions, like, why is sex important to you as an individual and to your relationship? Are there certain roles that you play? Is there a certain way that you experience your dynamic? It's like really honing in on those things, because, that previous slide talked all about penetration, and there's plenty of ways to maintain a degree of intimacy that is not penetrative. I work with a penetrative oriented product and like don't recommend it half the time, because if you're not ready, then don't do it.
Yeah.
So how is it that, I don't know, like, I don't know. I like the other night, my partner, we wanted to have a naked party. And so I grabbed a disco ball, brought it into the bathroom, and then put on music. And so we like took a shower together with the music and a disco ball. And that to me felt like a part of our relationship that we might not be able to access. So I mean, this is just kind of a list of some like tactical things that you can take away, like identify what your needs are. The carve out 30 minutes 2 times a week to physically connect. I like love that constraint, honestly, because it's very actionable. It's very reasonable. And it's like for an hour to just, whatever that means. Is it like naked cuddling? Is it dancing in the living room? Is it just like touching faces or like slow kissing in midday? And then kind of getting into like the logistics of sex. Honestly, it's like, this is important throughout our sexual journey. And I think this is maybe why that peanut study said that sex gets better, is because when shit gets hard, you have to articulate what it is you want. And so like, I almost appreciate my own experience in pain during sex, because now I can talk about it. And I can say like, hey, like, let's try this thing. Can we do this time? And it's always received well, because partners want to know, they want to help. They oftentimes don't know how. And it can be as sexually oriented as like up and a little to the left. And on the same token, it equates to, can you take the baby so I can shower? Like all of those things. It kind of gets into like the Kinsey, like dual control model of sexual response. So you've got your inhibitors and your accelerators. Like if you don't feel like you're able to get in the mood because you haven't showered, then how can you create space so that you can shower? or if like the laundry needs to get put away. You know, like accepting help is a really big part of creating space for you to feel sensual or even sexual if you want it.
Yeah. I think there was someone on Instagram who I saw, I don't remember who it was. I want to say it was UC Logic, who's like, foreplay starts immediately after the last time you had sex. And that I think really embodies.
Yeah. Gottman, that's a Gottman principle for sure.
Yeah.
Which is cool. It's like everything you do is foreplay.
Yeah.
And then the last thing that I love, it's the 3-minute game. It is the greatest gift of all time. Literally, all you do is you get a timer. You have to have a timer, and one person initiates. And they say, "How would you like me to touch you for 3 minutes?" And then the other person answers that. And you literally do that thing. The person who's giving the touch knows exactly what to do. The person who's receiving that touch, you can just chill out and receive it. And you don't have to perform. You don't have to respond. You just like soak it in. And 3 minutes goes by so fast. Like you, and then you switch and you do it to the other person, and everyone gets what they want. And like, honestly, if ever you're in a time where you're stuck in your head, this creates that pause to get into your body. It's really cool. I highly recommend it.
I like that. I like that a lot.
Yeah. Okay, I'm done. Whew.
All right. That last piece there, the mindfulness, there have actually been a lot of good studies that have showed that mindfulness can help with pelvic pain and pelvic floor dysfunction. So yeah, just a little note on that there. I don't know that we need to spend a lot of time there. Awesome. All right, stuff to use. Do you want to, I think that in terms of this, we've talked a bit about the OhNut. I think maybe we circle back around to that at the end if we want to again. I don't know about Dyspia. Rosie, I think is a great program.
I spelled that wrong. Dipsy. My bad.
Okay.
Switch.
Okay.
OMG, yes, I'm a huge advocate for. I gave it to like all the women in my family as a Christmas gift. It's just so wonderful.
Lubricants, you know, I like to joke that lubricants is going to be the pedestal I die on.
Yeah.
Because there are so many bad ones out there.
What makes a bad one?
A bad one is one that is not well matched pH wise to the vagina. So we're talking about water-based lubricants. You want something that is pH wise matched to the vagina, so it's not going to irritate those tissues. The one exception being for lubricant that is more matched to sperm in terms of fertility, which is a little bit higher in terms of pH. And then you also want a lubricant that has a low osmolality, which is basically a measure of how much stuff is in it and how much stuff is going to be absorbed into the body. So you want one that is under 380, and I always forget the unit, but keep it under that number. Do you know that the unit?
I'm like Good Clean Love. Like I did this study a while back where they put their Good Clean Love on a spectrum with all the other products on the market, and that can explain. The ones that I like in terms of the water-based ones, Slippery Stuff is a good one. Good Clean Love, like you talked about. Sliquid, Babe Lube, the Yes water-based, and there's one more that I'm missing. That's the water-based ones, but and then Uberlube is a silicone-based lubricant, which you can't use with a silicone-based toy or dilator. But my understanding from the OhNut is you are not silicone-based. Yeah, so it's a blended material, so you can use silicone lube with it.
Awesome. I think that's great. The silicone ones tend to last a little longer and don't have to be reapplied quite as often. So if you're not using something that's silicone, it can be a good option if you're having some of that vaginal dryness or that discomfort there. The toys there, I'm not familiar with either one of those actually. So I'm not, if you want to speak to those, Emily or Allison, go ahead. Those are not ones I'm as familiar with.
Allison, if you wanted, I think you put those.
Yeah,
down.
I mean, I think whatever toy works for you. I think the moral of the story is just if you want to use a vibrator or any other kind of toy, like you 100% should. There should be no shame about it. You should have as many different kinds as you want. There's so many new ones on the market that like do different sensations, and just don't be afraid to try them by yourself or with a partner.
Can I just a side note, and maybe I always say too much about myself, whatever. I'm not opposed to using toys. I mean, use them from time to time prenatally, but as I've felt more pressure to feel pleasure, I use the vibrator more because I'm insecure. It's a really interesting compensation. And I don't know how, I haven't said that out loud before, so that feels funny. But again, as with most of the things in the bedroom, it's not about the race to orgasm.
Yeah.
And, use a vibrator if you want to, but again, like Emily Nagoski, pleasure is the measure. If you're just enjoying yourself, that's the goal.
Yeah. I think another thing that's important is if you're having pain with penetration and that is leading to, a decrease in libido and a decrease in interest in sex, take it off the table completely. Just take it off, go do something else. And I think that the toys are a good way of incorporating that in, and then introduce penetration again as you feel more comfortable with it, or as you're, working with a PT, or you finally got your OhNut that you wanted to. So, doesn't have to be part of it. Yeah. I am a huge proponent of sex therapy. I recommend it to so many of my patients. I think it really is a good hand-in-hand companion to painful sex and PT. So yeah, and I haven't listened to either of those podcasts, but I will start soon because I listen to way too many.
Yeah. I'm a huge fan of Pleasure Mechanics. Chris, who runs it, she just puts so much energy into creating helpful resources, and she has courses on her website, and she's very queer and non-binary friendly. I love everything she does. I highly recommend looking up Pleasure Mechanics. They're just like wonderful humans. Yeah.
Awesome. I know we skipped over that top one, the OhNut. Did you want to say anything else on that, Emily?
It comes in 2 different sizes. There's classic and wider. I feel like now it's a sales pitch. I don't, we don't have to do that, but yeah.
We also have fun colors every once in a while. Just gonna put that out there.
I'm always excited one. Totally. People, there's a lot of interesting dialogue around like misconceptions around why deep penetration hurts. And most people assume it's because of the cervix bang and because of partner size. And meanwhile, most people actually, like when you talk to them for the first time about deep pain during sex, they don't even think about postpartum. Meanwhile, when you're in it, you're like, oh my God, like that's top of mind. So it's really, the first thing that people are often concerned about is how it feels for a penetrating partner. And it feels awesome. It feels kind of like you're going all the way in without going all the way in. And then to know that you're not potentially hurting your partner really gives the penetrating partner an opportunity to relax. And again, it does open up that dialogue that really wasn't possible before. So that creates a sense of bonding that also might not have been there. The possibilities are, for something as like simple and like, easy to, like, there's so many different ways to use it. And it's a really great, if you ever want to just have a little like cathartic emotional cleanse, just read the reviews on our website. It's pretty incredible, the hardships that people have gone through with pain during sex and then what they overcome. Yeah.
I know we have a couple of minutes left. We had a couple of questions that maybe I'll just throw out to both of you. One was tips for talking to their partner about hesitancy or nervousness about having sex again for that first time postpartum.
I mean, I like, it's like kind of speaking from like the I feel perspective, or like this is X is important to me, is speaking from the I stance is generally very helpful versus like when you do this or like when this happens, it's like if there's no finger pointing. So, because if you were just to say, sex is really important to me, but I'm afraid You can't disagree with that. And it just really cushions the potential like offense that we're afraid of, because it's just speaking about you.
Yeah, I like that. I like that a lot.
There was another question just around like, I think having sex that first time postpartum, like, should I have sex even if it's painful for my body to get used to it? Or how long is it normal for there to be pain with sex postpartum? Like, what does that look like?
I think that the how long and the, I'm not a fan of pushing through a whole lot of pain with penetrative sex. Again, unless that's something you want, but usually not. I think if it is uncomfortable, again, seeing a pelvic floor PT, seeing it, adding lubricant, sometimes that it's as easy as adding a lubricant, trying, if it feels like it is, if it's excruciating and super painful, definitely go see a pelvic floor PT. If it feels like it's a little bit of dryness, trying a lubricant, in terms of that time frame, it's, it depends, which is, as a PT is my favorite thing to say. And also the most irritating thing to say is it really depends on who you are. But yeah.
I would also add just like awareness. Where does it hurt? When, for how long? What is the quality of that sensation? Like really just keeping track of those details. And noticing if they get worse or if they're sustained, and just having that information, because there's sometimes might be micro changes that that again get blanketed under the guise of like, this sucks. But if we actually pay attention to those details, then we can address them more specifically.
Yeah. I think especially in terms of like the when question, if it hurts initially and then starts to decrease as you get going, within a single session, that can be an indicator that it is pelvic floor tension, and that, doing a little bit of relaxation is, that might be the ticket. Because as you get into it, as your body gets into it, there can be a little bit of relaxation. But if it's not decreasing, if that pain is increasing, definitely not a good sign.
And we had one more, which was around, how do I get my vagina and vulva tight so I can have a better orgasm? I don't know if there's like some myth debunking to be done there, but I thought that was a good question to end on, because I think, again, there's like so much just shame or expectation around this like tight vagina, but I thought you guys might provide some insight there.
It's just like thorn side.
I mean, I think maybe a little reframe would be important. Like, do you want it to be tight or do you want it to be strong? I would want it to be strong, and also, again, have that range. You want to have a muscle that it can relax and that can contract. Tight is not going to help you with a better orgasm. It might even make it worse if you're not able to also relax. If you're tight and the only muscle control you have is here, you're not going to have a good orgasm. If you can have a bigger range of that muscle contraction, it's going to lead to a better orgasm. So, I would counter, I don't know that you'd want a tight vagina for a better orgasm, but again, working those Kegels or the pelvic floor contraction and ranging, where you're inhaling and relaxing, exhaling and squeezing, you're getting through that range and contracting the muscles, getting them stronger, getting them able to relax, getting that range. That I think is going to lead to a better orgasm than just getting them tighter.
Yeah. And also knowing where that expectation is coming from. And just being realistic about that. And, is it coming from media? Is it coming from your partner? Is it based on education about the pelvic floor? And just deciding for yourself what's important to you. And it just blanketed under the tight pelvic floor. It's kind of, we wrote a really awesome blog piece about it. So if you want to look up the tight pelvic floor and Kegel myth, we've got some interesting historical stats about it, and just how it's reinforced culturally in really negative and harmful ways to women and people with vaginas.
Amazing. Well, that puts us right at 6:15. This has been such a wonderful conversation. So grateful. If you are, looking for a tool to help with penetrative sex, we got the OhNut. If you are having painful sex or any other issues related to your pelvic floor, feel free to reach out through Origin's website. But thank you, Emily and Morgan, so much for your time today. This was an awesome discussion.
Amazing. Thank you guys for coming.
Yeah, nice to meet you.
Bye.